Asthma. Anatomy and physiology of bronchi. The bronchi, singular, bronchus, are the airways that lead from the trachea into the lungs, and then branch into smaller bronchioles. Structurally, the bronchi are made up of cartilage that gives them stability and prevents their collapse. The bronchi function primarily as passageways for air, but also play a role in immune function. A number of different medical conditions can affect the bronchi, ranging from bronchitis to aspiration, to bronchospasm with asthma. The bronchi function as a passageway for air to travel from the mouth and trachea, down to the alveoli, and back out to the environment. Definition. Asthma is a common long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. These may occur a few times a day or a few times per week. Asthma is a chronic inflammatory disease of the airway characterized by hyperresponsiveness, mucosal edema and mucus production. This inflammation ultimately leads to recurrent episodes of asthma symptoms, cough, chest tightness, wheezing and dyspnea. Types of asthma. The most common type of asthma is bronchial asthma, which affects the bronchi in the lungs. Additional forms of asthma include allergic asthma, extrinsic asthma. Allergens trigger this type of asthma. These might include pet dander from animals like cats and dogs, food, mold, pollen, dust. Allergic asthma is more likely to be seasonal because it often goes hand in hand with seasonal allergies. Non-allergic asthma, intrinsic asthma. Irritants in the air not related to allergies trigger this type of asthma. Irritants might include burning wood and cigarette smoke, cold air pollution, viral illnesses, air fresheners, household cleaning products, perfumes. Occupational asthma. Occupational asthma is a type of asthma induced by triggers in the workplace. These include dust, dyes, gases and fumes, industrial chemicals, animal proteins, rubber latex. These irritants can exist in a wide range of industries, including farming, textiles, woodworking, and manufacturing. Exercise-induced bronchoconstriction, EIB. Exercise-induced bronchoconstriction, EIB, usually affects people within a few minutes of starting exercise and up to 10-15 minutes after physical activity. This condition was previously known as exercise-induced asthma, EIA. Nocturnal asthma. In this type of asthma, symptoms worsen at night. Triggers that are thought to bring on symptoms at night include heartburn, pet dander, and dust mites. The body's natural sleep cycle may also trigger nocturnal asthma. Cough variant asthma, CVA. Cough variant asthma doesn't have classic asthma symptoms of wheezing and shortness of breath. CVA is characterized by a persistent, dry cough. Cough variant asthma can lead to full-blown asthma flares that include the other more common symptoms. Cause of asthma. No single cause has been identified for asthma. Instead, researchers believe that the breathing condition is caused by a variety of factors. These factors include genetics. If a parent has asthma, offsprings are more likely to develop it. History of viral infections. People with a history of viral infections during childhood are more likely to develop the condition. Hygiene hypothesis. This hypothesis proposes that babies aren't exposed to enough bacteria in their early months and years. Therefore, their immune systems don't become strong enough to fight off asthma and other conditions. Early allergen exposure. Frequent contact with possible allergens and irritants may increase risk for developing asthma. Asthma triggers. Certain conditions and environments may also trigger symptoms of asthma. These triggers include illness. Respiratory illnesses such as the flu and pneumonia can trigger asthma attacks. Exercise. Increased movement may make breathing more difficult. Irritants in the air. People with asthma may be sensitive to irritants such as chemical fumes, straw inodors, and smoke. Allergens. Animal dander, dust mites, and pollen are just a few examples of allergens that can trigger symptoms. Extreme weather conditions. Conditions such as very high humidity or low temperatures may trigger asthma. Emotions. Shouting, laughing, and crying may trigger an attack. Pathophysiology. Signs and symptoms. Symptoms of asthma include coughing, especially at night, when laughing, or during exercise. Wheezing, a squealing or whistling sound made when breathing. Tightness in the chest. Shortness of breath. Fatigue. Diagnosis. Health history. The symptoms of wheezing, cough, shortness of breath, and chest tightness are not specific for asthma and can be seen with other pulmonary diseases. However, the combination of these symptoms increases the probability of asthma. The pattern of symptoms is usually varying over time and the patient may be entirely asymptomatic between attacks. Symptoms are usually worse at night, particularly in children, and can be provoked by exercise or other triggering factors, such as viral infections and/or smoke. Asthma diagnosis can be supported by taking detailed history including patient's occupation, family history of asthma, other allergic disorders, and smoking and vaping. Lists the relevant questions that are commonly considered when taking a history where the diagnosis of asthma is under consideration. Asthma control may be worsened by coexisting symptomatic gastroesophageal reflux disease, GERD, rhinosinusitis, obesity, sleep disorders, or the use of some medications, such as beta blockers and non-steroidal anti-inflammatory drugs, NSAIDs, including aspirin, ASA. Asthma and rhinosinusitis commonly coexist. Physical exam. It is important to note that the examination of the chest may be normal in stable and controlled asthma, but the presence of bilateral expiratory widespread, high-pitched, variable musical wheezing is a characteristic feature of asthma. This may be accompanied by shortness of breath or diminished oxygen saturation. Examination of the upper airways is important to look for evidence of allergic rhinitis, such as mucosal swelling, nasal polyps, and postnasal dripping. Other allergic manifestations, such as atopic dermatitis, also support the diagnosis of allergic asthma. The presence of a localized wheeze, crackles, stridor, clubbing, or heart murmurs should suggest alternative diagnoses. Therefore, a careful consideration of any alternative diagnosis before commencing asthma treatment by a physician should be made. Pulmonary function test. Spirometry. This test estimates the narrowing of bronchial tubes by checking how much air patient can exhale after a deep breath and how fast he can breathe out. Peak flow. A peak flow meter is a simple device that measures how hard patient can breathe out. Lower than usual peak flow readings are a sign that lungs may not be working as well and that asthma may be getting worse. Additional tests. Methacholine challenge. Methacholine is a known asthma trigger that, when inhaled, will cause mild constriction of airways. If patient react to the methacholine, he likely have asthma. This test may be used even if initial lung function test is normal. Nitric oxide test. This test, though not widely available, measures the amount of the gas, nitric oxide, that patient have in his breath. When airways are inflamed, a sign of asthma, he may have higher than normal nitric oxide levels. Imaging tests. A chest X-ray and high-resolution computerized tomography, CT, scan of lungs and nose cavities, sinuses, can identify any structural abnormalities or diseases, such as infection, that can cause or aggravate breathing problems. Allergy testing. This can be performed by a skin test or blood test. Allergy tests can identify allergy to pets, dust, mold and pollen. If important allergy triggers are identified, this can lead to a recommendation for allergen immunotherapy. Sputum eosinophils. This test looks for certain white blood cells, eosinophils, In the mixture of saliva and mucus, sputum, patient discharge during coughing. Eosinophils are present when symptoms develop and become visible when stained with a rose-colored dye, eosin. Provocative testing for exercise and cold-induced asthma. In these tests, doctor measures airway obstruction before and after patient perform vigorous physical activity or take several breaths of cold air. Management of asthma. Pharmacologic therapy. Short-acting beta-2 adrenergic agonists. These are the medications of choice for relief of acute symptoms and prevention of exercise-induced asthma. Anticholinergics. Anticholinergics inhibit muscarinic cholinergic receptors and reduce intrinsic vagal tone of the airway. Corticosteroids. Corticosteroids are most effective in alleviating symptoms, improving airway function, and decreasing peak flow variability. Leukotriene modifiers. Anti-leukotrienes are potent bronchoconstrictors that also dilate blood vessels and alter permeability. Immunomodulators. Prevent binding of Ig to the high-affinity receptors of basophils and mast cells. Surgical management. Bronchial thermoplasty is a treatment for severe asthma. It's a way to open airways. The procedure uses gentle heat to shrink the smooth muscles in lungs, the ones that tighten during asthma attacks and make it hard to breathe. Patient will go to a hospital to get bronchial thermoplasty. It's given in 3 separate sessions, with about 3 weeks between each. Each treatment lasts less than an hour, and a different part of lungs gets treated each time. Bronchial thermoplasty doesn't cure asthma, but it may make patient feel and breathe better. Nursing diagnosis. Based on the data gathered, the nursing diagnosis appropriate for the patient with asthma include ineffective airway clearance related to increased production of mucus and bronchospasm, impaired gas exchange related to altered delivery of inspired O2, anxiety related to perceived threat of death. Nursing care planning and goals. To achieve success in the treatment of a patient with asthma, the following goals should be applied. Maintenance of airway patency. Expectoration of secretions. Demonstration of absence, reduction of congestion with breath sounds clear, respirations noiseless, improved oxygen exchange. Verbalization of understanding of causes and therapeutic management regimen. Demonstration of behaviors to improve or maintain clear airway. Identification of potential complications and how to initiate appropriate preventive or corrective actions. Nursing interventions. The nurse generally performs the following interventions. Assess history. Obtain a history of allergic reactions to medications before administering medications. Assess respiratory status. Assess the patient's respiratory status by monitoring the severity of symptoms, breath sounds, PICO, pulse oximetry, and vital signs. Assess medications. Identify medications that the patient is currently taking. Administer medications as prescribed and monitor the patient's responses to those medications. Medications may include an antibiotic if the patient has an underlying respiratory infection. Pharmacologic therapy. Administer medications as prescribed and monitor patients' responses to medications. Fluid therapy. Administer fluids if the patient is dehydrated. Evaluation. To determine the effectiveness of the plan of care, evaluation must be performed. The following must be evaluated. Maintenance of airway patency. Expectoration or clearance of secretions. Absence, reduction of congestion with breath sound clear, noiseless respirations, and improved oxygen exchange. Verbalized understanding of causes and therapeutic management regimen. Demonstrated behaviors to improve or maintain clear airway. Identified potential complications and how to initiate appropriate preventive or corrective actions. Asthma prevention. Avoiding triggers. Steer clear of chemicals, smells, or products that have caused breathing problems in the past. Reducing exposure to allergens. If patient has identified allergens, such as dust or mold that trigger an asthma attack, avoid them as best he can. Getting allergy shots. Allergen immunotherapy is a type of treatment that may help alter immune system. With routine shots, body may become less sensitive to any triggers encountered. Taking preventive medication. Doctor may prescribe medicine for patient to take on a daily basis. This medicine may be used in addition to the one he uses in case of an emergency. Complications. Complications for asthma include the following. Status asthmaticus. Airway obstruction in status asthmaticus often results in hypoxemia. Respiratory failure. Asthma, if left untreated, progresses to respiratory failure. Pneumonia. Mucus that pools in the lungs and becomes infected can lead to the development of pneumonia.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.